spoke in favor of the work of health equity. Birth equity, sorry, birth equity. Okay, that's gonna go that way more. I guess 90. Yeah, there you go.
Do you have to admit people into the room?
Yeah.
Are you not on there now?
What? I'm on for sure.
Are you Dr. Truther?
Sorry, Sally.
Sally. Please, Parker.
Use the phone.
How long have you been?
You were Taylor Frozen.
4 years.
Yeah.
And they were all
My alias.
so sad.
Yeah.
They were going to come look at me and my lovely firstborn.
Yeah.
How you doing, Lyra? I'm John.
Nice to meet you.
Nice to meet you, Teresa.
All right, we're going to go ahead and call this meeting to order. We have a quorum and Dr. Kirsch texted me and said she'll be about 10 minutes late, but that she will be here. So going on to agenda item number 2, adoption of the agenda. It's recommended that the Board of Health members adopt the agenda for June 15th, 2022. Let's see, how do I always do this? May I have a motion?
I believe there's an agenda item for new business that's not on the agenda, the one we had an email about, which is the internal board policy that I would move we add to the agenda since it was meant to be there.
Thank you. I have a motion on the floor. Do I have a second?
I'll second that.
Thank you. So we have a motion then to adopt the agenda with the addition of the resolution. Is there any other discussion? All those in favor, say aye.
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 Any opposed? The ayes have it. We've adopted the agenda. Item agenda number 3 is approval of the minutes. Recommended the Board of Health members approve the minutes of May 18th, 2022. May I have a motion?
And so move.
Second?
I'll second that.
Thank you. Any discussion on the minutes?
The only thing, I'm trying to remember, I thought it says here that there was no public comment.
I added the 3 people.
Oh, did I not? Maybe I didn't see the right thing. Okay,
I
so
also took the T out, it's actually transmitted.
thank you. I found it typo. Okay, that was my only question. I must not have seen that. So, no problems.
Great. We'll take a vote to approve those minutes. All those in favor say aye.
Aye.
All those opposed say nay.
Nay. Oh. Aye.
The ayes have it, so we have approved those minutes. And then agenda item number 4 for board president announcements. I don't have any announcements. I'd actually like to give an opportunity to welcome our new board member and give you a few moments to introduce yourself and then perhaps share about your passion for public health.
Okay. Hi, I think I've met almost everyone in the room. My name again is Teresa Crutherd. I've been working kind of on the front lines in the healthcare arena for about a decade as an anesthesiologist. So lots of patient education and clinical care there. I have since, in the last year, moved more toward medical consulting as an anesthesiologist. I hold a couple board positions, one with an international organization that primarily works in Tanzania on sort of water, health, septic, power, connectivity, that sort of thing, which is something we have a little bit in common of. And I also own a business. So I'm a local entrepreneur. Most people heard on the radio. I didn't know on the radio. I do some business consulting for small businesses also there. So here, I think my passion is more for patient education and prevention, that sort of thing. I did a lot of that, health and wellness, when I was practicing as a clinician, and now sort of with the Tanzanian endeavor, it's a ground up. They don't have anything that we have. They have no infrastructure. So a lot of that is sort of a lot of the environmental things that you guys are doing here, and just helping sort of set up well systems that are functioning and working, and making sure there's clean water kind of as a baseline, and dealing with food scarcity. I know there's some food people here. So we don't have sort of those kinds of big issues, but still prevention and education are big things. So I think that's primarily my passion for being part of my local community's efforts. So thank you for welcoming. I feel like I've gotten a pretty strong welcome so far. I look forward to working with everyone. Thanks. You're welcome.
And then this may have already, the conversation may have already happened to schedule an onboarding so that Teresa can meet with the directors. That's probably already happened. Yep, great. All right. Fantastic. Well, welcome. Thank you. Moving on to agenda item number 5, the health officer's report. Dr. Bob, I turn it over to you.
Perfect. And yeah, on behalf of the department, we welcome you as well, Teresa. And look forward to learning more about what you're doing in Tanzania. I'm sure we'll have some good discussions about that. And apologies to everyone for this god-awful face covering, but I was just notified that my daughter, who my wife and I have been kind of in bed watching TV together, just got diagnosed with COVID. And so hence this mask. So at any rate, you should all have received the health officer's report. It's pretty milquetoast, nothing particularly sensational, tantalizing, or out of the ordinary. And have gone to all of my unit directors, asked them if they wanted me to emphasize anything. I got a big goose egg out of everyone. And so I'm happy, as always, to answer any questions that you have and rely upon the unit directors for their support.
So we'll turn it over to board members. What questions do you have about the health officer's report?
I have a few questions. So first of all, I think the one thing I was wondering about in the MIH initiatives here with the funds, they talk about public info and education. I guess I'm just wondering what that's being spent on.
Yeah, I think that's predominantly being spent on
The $12,000.
Yeah, predominantly spent on the conference, but where's?
Oh, are you still paying for the conference?
Where are you?
Everything here you paid.
Oh, okay.
Yes, yeah, everything has been paid.
Okay, I'm just wondering if that's new initiatives or that's still stuff for the conference. Okay, okay.
And then so.
That was a birth, Dr. Cruther, for your information, that's a birth equity conference.
Correct. And anything we took in that was left over from the conference will be utilized on other efforts as it relates to birth equity.
So with the COVID sites, the COVID testing, the COVID sites, is there a reason why do we still, if we're giving at-home tests, giving out at-home tests, we still need to have a testing site open? Maybe I asked this last month, but I guess I'm.
Yeah,
Or is it still required to have a testing site open?
We continue to do the social needs assessments.
Okay.
Right, so we do social needs assessments and our community health workers are out there. Did you want to say something about that?
Yeah. So that's not just a COVID testing site. We have 2 community health workers who are over at La Casa in the 2910 Western location offering social needs assessments, but also offering the COVID test as well. There are still several businesses that require a letter stating that the test came back positive, and so the at-home tests are not sufficient enough for some of the businesses. And so they're offering for them to do the test there and signing off as a Department of Health community health worker stating that they observed that it was positive.
Okay. So, and then can I ask a couple of questions about the FEMA stuff?
Fire.
So I'm curious, one of the things that they said, FEMA case review and FEMA reporting completed all but 4 of the 2021 infant and fetal death cases. I was trying to remember, I think at least maybe it was from the the health equity report. I don't know if we had the 2021 numbers on fetal and infant deaths. Do you have those numbers now, or can we get them just from the number of cases that you reviewed?
We can get it from Sally Dixon,
Okay.
but she's on vacation.
Sally's on the line,
Oh, she is?
actually.
Oh, okay.
Yeah.
Oh, she can't talk though because she's on the line. So,
Okay.
so we can get that
Yeah, we can
information
get
for
that
you at a later point.
Okay.
And she does have that, I would assume. Is that correct?
We do, and I apologize. I just don't have it off the top of my
Sure,
head.
of
And I
course
don't want to misspeak.
Okay. Okay,
And it's not public until the state, we have to
Yeah.
wait for confirmation from the Indiana State Department of Health vital record system.
okay, so does that mean I can't get it, or does that just mean?
No,
the
you
public
can't, that's just why it had, like, the report is hasn't come out, yes.
Okay,
Yeah.
okay, because I was just wondering about that. So you can't release it publicly, but I can get it. Just know it's like.
As preliminary.
Okay, as preliminary, okay. And then, this is something that I realized I had not asked about. I guess I never got clear confirmation on it, but who makes the final call regarding who gets on the FEMUR team? Is that you or Sally Dixon, or is it just kind of like a consensus among people who are on the team?
It's usually a consensus, so with the other existing case review team members, so it's so Sally, there are best practices on who you want to include on that team. We then have vetted lots of individuals to be on that team. And then as we meet new individuals, we interact with new people, Sally and I will have a conversation on whether or not we think they would be a good fit for that team and what would they bring to the table. And then we bring that up to other members at case review, and that individual is either accepted or not accepted.
Okay.
One question I'm sorry,
Oh, no.
one quick question on that. I noticed reading the report this month is that these are called subcommittees. What are these subcommittees
Yeah,
about?
it's probably a subcommittee is a misnomer. Probably should call them working groups. So what happens here is FEMUR is, there's a state statute that produces, that sets up these FEMUR teams. And pertinent to your question, Alan, that statute, I'm guessing you're probably aware of this, lists the type of individuals who they recommend being on the FEMUR team. And the charge to the FEMUR team is to come up with recommendations that will decrease the infant and fetal mortality. And that's exactly what the FEMUR team has done. So the FEMUR team has come up with 5 different recommendations. And then we, as a health department, under Robin and Sally's leadership, have instituted or implemented a number of initiatives then in concert with these 5 recommendations. And so the recommendation coming from the FEMUR team first was to eliminate racial, ethnic, and socioeconomic inequities. So that was one recommendation. This then becomes a charge to the maternal infant team, Robin and Sally, to figure out how do we do that. Number 2, and so they put together a working group. I understand they called it a committee. I personally wouldn't have called it a committee. I'd call it a working group. The second was to provide data, and again, the recommendation from the FEMUR team, which the FEMUR team, to be clear, is across the spectrum here. Politically across the spectrum, and the concern, obviously, the elephant in the room here relates to Roe v. Wade, et cetera, across the spectrum there as well. The second recommendation from the team was to provide data, information, and continuing education to elected officials and maternal child health professionals. Here again, working group, how do we do this? Third, improve sleep-related death prevention education for providers and families. Fourth, connect mothers to first trimester prenatal care and integrate clinical care and community-based organizations to provide connection and support. 5, improve women's health before and between pregnancy through access to information and affordable health care. And so they have formed these, what they call committees. I would call a working group. It is part of what Sally has been reporting to you all over she reported two meetings ago.
Last meeting.
That was just on the birth equity work, but yes.
And so a year ago, and then this year, these are the maternal infant health initiatives of the Department of Health, addressing these recommendations that have come from the FEMUR team.
Did we as a board at some point adopt or approve those initiatives as something we want St. Joe County Health Department to?
I don't need your approval. I appreciate your approval, but this is all part of the, no, I'm just saying it's not, you don't have to approve it in order for us to do this. is part of the work of the department. And this is what we report to you and have reported to you. And so if you're asking, is there a board stamp of approval on the various initiatives that we do within maternal or within any other unit, the answer is I'm not aware of it.
It just seems odd that some outside body is telling the St. Joe County Health Department staff what to do, but I guess that's your.
No. There is no outside body telling us what to do.
This FEMA board, I thought
The
they're.
FEMA board comes up with recommendations. It's no different than like when I created the strategic plan. You know, what are people recommending out there? What should we be doing as a health department to address X, Y, and Z? And in this case, we have an unacceptable, any maternal death is unacceptable. Any infant death is unacceptable. We clearly have a really an embarrassing and shameful disparity with Black infant mortality, 3 times higher than white infant mortality. And the question is, what should we as a health department be doing about it? What should you as a board of health be doing to reduce that disparity? And so the FEMA team was set up by the state then to come up with these recommendations. We listen to those recommendations. We don't have to respond to them.
But the board didn't, I support them, don't get me wrong. I'm just saying the board never, like we would with the.
Oh, yeah, no,
plan.
I'm not, yeah, no, I hear
I'm
you.
just saying we didn't officially adopt those 5.
They've been presented at the board.
Right, and the
You
FEMA
are-
program is a program of the Department of Health, and that Sally oversees our FEMA program. Part of that program is the case review team, as well as a community action group. And the community action group is broken into those work groups that you were inquiring about, rather than it being a large group of lots of service providers that at times could be ineffective. What format works best for us are those smaller working groups addressing those recommendations. The recommendations are woven through all of the cases we review. So the recommendations are data-driven from us reviewing every single fetal and infant death in our county. And then those recommendations are agreed upon by the case review team. And we hold that review team quite close because we know the information that we discuss and we share. We've never said no to anybody being on the case review team if we've deemed it adequate for them to be a part of it. And that's where those recommendations drive from. And we had recommendations, we've only had them for, I believe, 2 years because we didn't have enough data to say what is causing our infant mortality rate here in St. Joseph County. And then as we got more and more information, more and more data, more and more cases reviewed, we were able to weave together those themes. So the things that come out as recommendations, those are things that we know if we address, we will decrease infant mortality of all babies in St. Joseph County.
You know, all the data is presented in a public forum every year by Sally Dixon. And the people who receive that data in person have included all of our state and local legislators, the media are all invited to her presentation every year.
Yeah, we do.
So if you are interested in seeing that data, you know, attend her yearly presentation because it is a very good overview.
So what about the meetings of the different subcommittees / working groups? When is there a posted schedule for when these meetings are occurring, or
They're an open meeting.
they're an open meetings? Where is it posted? Where can we find that information?
I don't post any of
Yes,
no.
you can reach out to me and to Sally. All of our working groups have set meeting days and times and efforts that they're working on within their respective organizations and collectively across the county.
Okay, so
We meet with community, Alan, we meet with community groups all the time.
Mhm.
And I would guess every single day, we're out there in the community, meeting with groups, individuals, institutions. None of this is under a basket.
okay, so if we wanted to know, like if I wanted to say, I want to come to, I don't know, I have time, I can manage to come to the, June 16th meeting. Even though I can't, but,
Pardon?
Which June 16th?
I'm like, the next meeting, June 16th, just because that's tomorrow, that's the date I saw.
Yeah,
that
we're
this is
springing toxic.
The FEMA meeting is, the FEMA team is a little different, as you know. Here
Yeah.
we're discussing.
Where you're discussing confidential data, right?
Right.
But as long as it's not
That's not a-
confidential.
Yeah, the FEMA team is not open to just anyone coming.
Mhm. Yeah, but I mean, as long as you're not and I understand that, like,
We're always
you're
discussing confidential things on the FEMA board.
Well, no, that's not.
okay.
So there's, just like I don't know if we post, so you're gonna tell me, do we post the sewer and the water and the agricultural board meetings?
Sewer and water ones get posted.
Yeah.
So the FEMA board meetings under the statute says that it contemplates public meetings. I mean, at a minimum, you guys should have an annual
There is an annual.
There is an
meetings
annual.
where you like set like who's on the committees, who's on the board, who's doing, and that's all public. That has to be
That's
public.
But when
And
we're
it'd be
talking about
posted the same
cases,
place.
that's. more
Right, and that would be
closely held.
posted the same place that the water board, the sewer board,
Right.
the agricultural board, which we're forming, is that forming it?
We've been trying to get it formed.
So those, so there's at a minimum, we gotta have an organizational meeting for that board, that team, that committee, I don't know what you guys wanna call it.
That's, you can look that
But
up.
not called a board, though. It's not
It's
called
not a board.
It's,
And it's
It's
just,
not
it's
a
no
board.
different than the child fatality review team. That happens, that's a requirement of every county to have a child fatality review team. It actually just met this morning, similar to our suicide and overdose fatality review team. So those things are suicide and overdose is newer to the statute, but child fatality and fetal and infant mortality, those things are required. There's a statute through the state. They have state coordinators through the Indiana Department of Health. And then they filter out, but we don't post child fatality review meetings either.
So you're not, the statute's bifurcated, right? So whenever they meet and they talk about any of this other stuff, these 5 objectives and how you're driving towards it, that's public. That's a
Right.
public meeting.
Yeah.
So that needs to be posted and anyone can go.
I can't believe that's true.
I don't
mean,
think that's
that
true
means
either.
Every single time that
Every single
Mark
community meeting
Mark
has to be
Espig goes
posted.
and meets with 2 people about XYZ, safe water, or anything else that has to be
Not every
posted.
time he does. When the sewer board meets, when the water board meets, those are posted public.
Oh, that's a
meetings.
board, but we're talking about the activities of this department. And every single time that I go out into the public and meet with 3 people, that I have to post that publicly?
No.
What's the difference?
That the statutory committee, if you want to call it a committee that was formed, right?
No.
In the statute.
Which statutory committee?
The FEMA,
It's not called a committee.
That's a review team.
It's called the review team.
okay. In the statute, it says that it's open to the public except for the case reviews.
Actually, I just read that about 3 times and it says something quite different.
I have it.
Go ahead and read it.
Do you want me to read this section on open meetings? Except as provided under subsection B, a local fetal infant mortality review team meeting is open to the public. A local fetal infant mortality review team meeting that involves confidential records or identifying information concerning a fetal death or an infant death that is confidential under state or federal law must be held as an executive session.
So when you're talking about that stuff, that's not the case reviews, they're open to the public.
Okay, and that's and define the team for us, if you would, please.
Wait, which, you mean
Define,
by the statute, they just say local fetal infant mortality review.
how does it set up?
How is what set up?
By statute, how is the committee, how is this team set up?
How is the team set up? You mean establishment of a local infant fetal?
If I could.
Do you want to
take
have,
that.
yep, take it.
Well, you're looking at that.
Upon establishment of a local fetal infant mortality review team under this section, the review team shall notify the statewide fetal infant mortality review coordinator of the establishment of the review team. A local fetal infant mortality review team shall review the fetal death or infant death of a resident and may review the fetal death or infant death that occurred in the county or area for which the review team is established. Does it say anything about open door there?
No, we gotta keep going down.
Okay.
So, and then when they're
Hold on,
reviewing those,
hold on.
then
And what is
absolutely
the
not.
charge to the review team?
Those are executive sessions of that committee. So those would be closed to just the members who are reviewing.
Okay.
The section 8, which is right above the open meeting section, talks about confidentiality and what information itself needs to be confidential. And so like when you're discussing data concerning fetal deaths or infant deaths, things like that, that's confidential. Or like specific.
If I may,
cases.
I've been on the FEMA team since its inception, almost 6 years ago, and there has never been a meeting that I've attended that did not involve completely case review. So I don't know what you're looking for to attend, but we never meet except to discuss cases.
Well, I guess I'm looking like right here, it says FEMA Community Action, Birth Equity and Justice, St. Joe County. At the meeting that they're having tomorrow, they say, we will view the film and strategize how to use it within the community to engage and facilitate
It's not the
conversation.
FEMA team.
But,
It's not the FEMA review team.
okay,
Right.
It is not. It
Like,
is.
I'm not going to be attending that tomorrow.
okay,
This is what we as a health department do to implement the recommendations. Was the FEMA team charged with implementation? Find it in here if you can.
I'm sorry, with
Implementing the recommendations. No, the answer is no. They weren't charged with implementing the recommendations. They're charged with creating recommendations.
So I guess my question though was simply, I just wanted to know if we were allowed, I mean, if we were allowed, like, when are the meetings and can we go to the meetings?
Robin just told you, if you want to know the
Okay.
meetings, ask her.
Yes, that's what I was trying to get.
The
So-
work group meetings. You want to
Yes.
know about the
Not-
work that's happening
Not-
Yes.
as part of the
Yes,
recommendation.
exactly. I'm not where you're reviewing actual cases. No, of course not. But when you're talking about maternal infant health preconception work group, birth equity and justice, policy and legislation, those are open. Where we can go,
Yeah,
okay,
always.
okay, okay.
Who's on these work groups? It's not the FEMA group.
No, it's individuals,
From the
organizations, right? So community action, best practice is they're made up of all the individual organizations that work in that pre-baby, pregnancy, post-baby space.
Good.
And because they're the ones doing the work. So when we have a recommendation, it's taken to them, say, how do we fix this? Or, how do we overcome this barrier, et cetera.
Okay.
So those individuals, they're the hospitals, they're healthy families, the WIC clinic, our mental health providers, and that's a new trending thing we're identifying as maternal mental health as it relates to infant death. And we look for those individuals in the community doing the work to bring them in to work collectively and cohesively to address the issues.
And to be clear, we would love it if every single member
Yes.
of this Board of Health sat in on these meetings and helped us devise interventions to reduce fetal mortality and reduce infant mortality. You are welcome to be there, because so far I haven't heard a damn thing come out other than objection to what Sally Dixon and her team have been doing to decrease maternal mortality, infant mortality, and fetal mortality. That is what they do. And that, quite frankly, is why you're on the Board of Health, to champion the activities of this department as we try to reduce, as they try to reduce infant mortality and maternal mortality and fetal mortality. That is who we are. That's what we're about. And we're particularly concerned about the health disparities and the fact that Black infant mortality in this county is 3 times white infant mortality. And why is that? And what can we do to reduce it?
And that's reflected in national statistics.
I
I would
I don't
like
I don't think,
one more comment. We should probably
well,
move the conversation forward.
I do have something else that you know, I want to say that I feel that I have no reason to doubt. I truly believe that everybody here is concerned about moms and babies, concerned about maternal health, concerned about infant health, concerned about fetal health, preborn babies. I know I am. So I think, and I know we've discussed this before, I think that on this board, there are very different perspectives about what entails the best way to ensure infant and fetal health in the community.
You're talking about
On this board?
On our board and in the health department, I think there are probably differences look, for example.
That's kind of normal. I mean, that's public health. We all bring a different perspective.
Yeah.
Whatever education and experience I've had, I bring to the table. So to me, that's normal. That's where civil discourse comes into play. We bring our ideas to the table, we vet them, and then we make decisions together.
Mhm.
That's the nature of public health.
Yeah, I mean, it's just, you know, I want to know, you know, what is being discussed at these meetings and things, because
Ellen, you've been told that you are invited to come.
I know, I'm glad. I wasn't aware of that before. I mean, again, I'm new, I'm still trying to figure out a lot of these things in terms of what's available.
If this is something that you have a particular interest in, why don't you go and educate yourself and
I will.
see what's being
I will.
discussed, because you know, your knowledge of fetal and infant mortality and maternal mortality comes from what you know as a layperson, and people on these boards are not lay people, and they have a lot of knowledge, and they would share that with you if you would, you know, medical knowledge, if you would attend.
I know.
Maybe we can move on.
Yeah, I guess the only other thing then is, I was going to ask, the other thing that I was wondering about is, they talk about, the Policy and Legislation Committee is talking about, in response to the upcoming SCOTUS decision on access to abortion, they're working on a draft explaining the importance of maintaining exceptions for maternal health, rape and incest, and lethal fetal anomaly to protect the life of the mother. Can we get drafts of that work that's being done? Can we just come to the meetings and observe? Okay.
Just out of curiosity, do you have some objection to trying to decrease to what they're trying to do?
I want to say, I want.
What in what you just read? What in what you just read bothers you?
Pardon?
What in what you just read bothers you?
Well,
You're talking about decreasing maternal and child and fetal death. That's what they're working on. And we recognize, and you recognize, that if every single woman carried that fertilized egg to term, there's going to be more deaths of moms. The rate doesn't change. You and I had this discussion. The rate doesn't change. You and I know. Have you ever sat in front of, as she has, a woman hemorrhaging from a bruceo placenta with the blood pouring down your feet? Because I have been here, okay? And knowing that that woman is going to die if you don't try to deliver that fetus. Have you ever been in that situation? Have you ever been in that situation?
no, of course not.
Have you ever thought about that situation?
Yes.
And what about, this is going to trigger some people, and I apologize for this. Participate with them. Go ahead. There isn't anything in what you just said in terms of decreasing maternal and infant mortality that they are doing that would go against anything that you believe in?
I know it's fetal mortality that I'm concerned about. But really what I wanted to know was just if we're gonna be able to get access to a draft and see if we can just review it and know what's coming out of, and know what's coming out of this. Because, you know, I mean, people will ask me if it's public, like, just like everybody else on the board, you're on the Board of Health, what do you think about this? And I need to know what's happening, so. Anyway.
Are we ready to move on to new business? We added an item earlier part of the agenda for a resolution. Do you want to read the resolution or you want me to read it?
Got it already.
Would you give it? Thank you.
Oh, this is what we discussed 2 meetings ago. And he said, I won't read it verbatim, but I just summarized actually. I don't even care for that. It says that to participate in the Board of Health meetings, you have to be at the meeting. So whether that's staff, whether that's a board member, whether that's a member of the public. Like I said, that's what we talked about a couple meetings ago. If you will recall, in the throes of COVID, we have a separate policy for emergency meetings that complies with the state. So you guys can suspend and go back and forth as you want. But to go back to the old in-person meetings, that's what this policy does.
That was one question I had.
Questions?
Is if the same thing happened and the governor does the emergency thing,
We can go
does it
back.
automatically happen so that we don't have to have a meeting in order to make it happen, right?
Correct. So what? That's a trick question. It depends what the governor says in his order, but yes, it could very well be an automatic thing. I mean, if there's another public health emergency, if there's COVID 23, probably shouldn't even say that.
At least make it 28 or 20.
then yeah, we would go back to the virtual meeting policy that we have.
So to be clear, Marcel had made this recommendation that we formalize this in a resolution. This is an internal policy for board specifically. So that's what this is about. So now if I may have a motion to accept as it's presented.
I would so move, accept that as presented.
Second,
I'll second it.
thank you. Any discussion?
I think you know how I feel about it. I just think the way the meetings have been going with the public giving their comment has been acceptable to me. And I like to hear what the public has to say, give them more access to us as a board to promote the health of the county. But
Appreciate that.
let's say that.
I'm sure the last sentence in the let it be known paragraph, the Board of Health does not pledge nor promise nor otherwise establish that its meetings must be live streamed. I guess I'm not sure, do we need that? It seems repetitive, but also it's like,
I just want to cover my bases for technical difficulties.
okay,
Because in the event we have an internet interruption or there's computer malfunction or
okay,
we're using county software
okay,
and or hardware.
okay.
That's the only reason. I mean, obviously pursuant to the stuff we previously talked about, we're going to try to video them all. We'll try to archive them all, try to post them all.
Yeah,
But I just don't want, I mean, if it's not possible, I don't want you guys not to have a meeting when everyone shows up
Okay.
because we've got technical difficulties.
okay. I was thinking taking reasonable measures covered that, but I can understand wanting to be clear.
Hearing no other discussion, we'll go ahead and vote. All those in favor of accepting the resolution as presented, say aye.
Aye.
Any opposed, say nay.
Nay.
The ayes have it, so we pass this resolution. Moving on to the next item under new business is the discussion and vote for the nursing fee schedule. So I'll turn that back over to Dr. Bob.
I'll turn it over
Well,
to
then,
Jody, if I could, please.
yes, to our nursing director.
Okay, we are looking at 3 different vaccines. One is Vaxalis. It is for 2 to 4 6-month-old babies. It's a 6-in-1 vaccine, which covers diphtheria, tetanus, pertussis, polio, Hib, and Hep B. So it helps the baby not have to get multiple shots. And gets good coverage for that. Plus, you know, it comes in a pre-filled syringe, so there are less mistakes giving it. So, and I know that Beacon has gone to it, and Elkhart Health Department has gone to it, and they liked it. So that's the one Vaxalis that we wanted. The other is just kind of coming up to date with the pneumococcal vaccines. In 2021, the Advisory Committee on Immunization Practices recommended the CDC to change the guidance on immunocompromised adults to receive the PCV20 and PCV15 because it covers better. So we're just wanting to get that so that we can give it to our patients when they come in. PCV20 is a good multi-purpose vaccine.
Questions about the fee schedule?
It's definitely in line with the standard of care that is happening across our community. That's absolutely the right thing to be moving towards. So improve compliance and get more kids vaccinated fully more quickly. And that's a great thing. Support.
I have a question because I saw that Vaxalis vaccine. It's not cheap and but it's giving so many different protections. Do we get adequately reimbursed by insurers from that, including like Medicaid?
I would have to check into that for you guys.
It is covered by Medicaid, so we are reimbursed for that.
Okay, wonderful.
And then most of our private vaccine is through Baxter, where we're just getting the administration fee.
Right, they're dealing with it.
So, and then what this does is sets the fee for a patient who doesn't qualify for Medicaid or the state 317 and doesn't have insurance through Baxter where they'd have to pay out of pocket. So that this really sets that fee more than anything.
Right. Which is not most of the people getting it.
Right. And you know, this is a question about approving the fee, not about approving the vaccine.
Vaccine.
Right, exactly.
Vaccine's already been accepted.
We're going to do the vaccine. We're just asking you to approve the price that Amy has recommended.
Right. I would defer to you.
I would defer to you as well. And you've been doing this forever and a day, so you have the experience to be able to do this. So,
Okay.
Any other questions about the fee schedule? Otherwise, we'll go ahead and go for a vote. All those in favor of approving the fee schedule, say aye.
Aye.
All those opposed? The ayes have it. So we've passed the,
Somebody make a motion, just to be clear. For the record, I didn't remember it.
you're right. I'm not sure I did ask for a motion. I think we just started talking about it.
I'll make a motion to approve the fee schedule as presented.
Thank you. Could I have a second? Thank you. So now all those in favor, vote aye.
Aye.
All those opposed, say nay. The ayes have it. So we've passed appropriately the nursing fee schedule. Thanks, John.
I don't know if we got a first and second for the resolution.
Yes, we did.
We did.
Yes.
Yeah.
Who's that? I don't get it.
Dr. Mercer and then Alana.
Okay.
Oh, that's right. It was a lot. Okay, so the next agenda item is the 2023 Department of Health budget request. And so I'll turn that over to Dr. Bob.
Should have in front of you and received already the memo related to the budget and the budget itself. So I'm going to walk us all through this.
If I may just interject a moment. So the Finance Committee met twice with Dr. Bob and Amy to discuss it, to get it into the present state that it's in. So I want you to know that board members have put their eyes on this and reviewed it and asked lots of questions. We had really good meetings. We've had really good meetings. And so this is the outcome of that.
So as I go through this, if you would, I think probably best as I go point by point. If you have questions about anything that I'm saying, just raise it as I raise it. So
Dr. Bob, sorry, could you just give a quick overview of this whole process for some of our board members?
yeah, I actually met with them.
Oh, you got it. Okay.
For an hour.
All right.
Yeah,
Never
so,
mind.
It's so much fun to do it again.
yeah, I don't mind doing it. So the budget that is in front of you is sustainable through 2028. In other words, though we will be using our fund balance, as I had mentioned to them previously, and as we all have discussed, a couple of years ago, our fund balance was good only through 2023. We're now proposing a budget that will enable us to remain solvent through 2028 at a minimum. The Department of Health is increasing its efficiency by restructuring and right-sizing our nursing unit. We have done that, if you will. I have used the term downsizing. I will not use that term in front of the county council, but that's basically what we've done. We have become more efficient and maintain productivity. We're going to right-size our nursing unit, and we're in the process of implementing an electronic medical record, which should make us more efficient, particularly in terms of our productivity. So I expect greater productivity with the EMR once it gets up and running. It will take some time, of course, for that to happen. We were quite entrepreneurial over the last couple of years, and we've earned more than $1.6 million from a COVID vaccination, the vast majority of this coming from payments by the insurance companies for these vaccines. And as noted, these provide opportunity for innovation and allowing us to become more competitive with our own salary and wages here relative to our competitors, which would be both the private sector as well as departments of health locally in the region, that is. It's important for all of us to recognize that cost of living in 2022 increased. Actually, the numbers I have all in front of you were from April. And if we just read the numbers in May, and now the cost of living official from the government up to 6.6%, and it's projected to increase to 8.5% in 2023. And I've given references there. According to the U.S. Bureau of Labor Statistics, the all items increased to 8.3%. In fact, as of May, it's now 8.6% for the 12 months ending in April 2022. And all of us recognize the really significant increases that we've paid at the pump and in the grocery stores. The most recent, again, for food index is up to 11.9%. So, and then if we look at what's happening to hourly wage around the country, according to the Federal Reserve Bank of Atlanta, as again, this as of April, is 6.2% higher than a year previously. So all of this clearly justification for what you'll soon see is, or you've already looked at and have seen, that we are asking for a 5.9% raise minimum for everybody. And I'll explain why others had greater than that, except for Dr. Fox and myself. The Department of Health, we continue to be highly entrepreneurial and looking for extramural funding so that we weren't having to tap tax dollars. And so we have written current staff into 5 different grants. This offsets the funds from again, tax dollars and fee dollars, the county health fund. And so it does provide a little bit of relief for our county health fund and US and the county taxpayer. And then we have, of course, pursued a lot of extramural funding, and will continue to do so at least as long as I'm here. And compared to just 3 years ago, 4 years ago, our number of grants are significantly greater, come from multiple sources. So the budget changes that you will have noticed, we've increased the salary of really all staff to increase the competitiveness in the job market. Some we've increased beyond the 5.9%. Again, if I can take a step back for this group, you recall that when I first came here, I thought that the lowest paid workers were, quite frankly, in poverty level pay, and we focused, and you all as Board of Health focused on increasing their salaries. You did that, and the county council accepted it. We then looked at trying to increase and making more competitive the director salaries. We did that, and I think we've got a reasonably competitive now at the director level. It was the folks in the middle that was the intent of the third year. Unfortunately, inflation and all is going to eat away a little bit of what we're trying to do, but in terms to make them more competitive, you'll see that a number, almost all of them, have had a greater than 5.9% increase. So we did, though, we eliminated 1 full-time nurse. I eliminated a special projects officer. I eliminated one of the 2 directors of nursing positions. And we consolidated 2 positions into one, all of this being cost savings and in terms of folks who are dependent upon the public, the county health fund. We did add 1 community health worker to the countywide lead initiative. You all except you, Teresa, will recall that that initiative has been relatively underspent over the last several years, and now we're becoming much more aggressive in some new and innovative approaches to reducing lead. In addition, the state has now dropped its level for case management and case monitoring, and we ourselves, of course, are doing the same. And so the amount of work that we'll have to do in terms of case monitoring and management is increased, and so we do need additional help there. And then we're appropriating, of course, some of the 1.6 million, and which is essentially appropriating our fund balance. Personnel changes are pretty much what I've already said as relates to the budget changes. We did make a decision, rather than hiring BSNs, which are more costly than bachelors of science or CMAs, we did eliminate 2 of the nursing positions and substituted a CMA and a bachelor's of science, which provided cost savings yet again there. As we've already gone through. We will once again inform the council and plead with the council for getting a space. The space that we have is woefully inadequate. You've all, the elevators went out the other day. I can't imagine anyone coming in for immunizations with their 2 or 3 kids in tow and having to walk up 9 floors to get their immunizations. But even with functioning elevators, it would be nice to be on a main floor with parking adequate for individuals who wish to bring in their little tykes to get their immunizations. In terms of our budget challenges and opportunities, our salaries currently are just not as competitive, and for retention, for obvious reasons, recruiting top talent, et cetera. Of course, we need to make them competitive. For an example to share with you all, we received the advertisement for Elkhart Environmental Health, and the Elkhart Environmental Health, I got it here in front of me, but bottom line is, for an entry level, they were at 51 to 54,000 right in that area, and ours salaries are below that right now. And you'll see that what we've pegged it at for their environmental inspectors is at 52,000 this upcoming year. And then, in addition, you'll notice in a couple of places on the budget, and if I can turn to the budget right now, if we look at the 3rd page, where we go from 0 to 100,000 and 0 to 25,000, so miscellaneous costs and contractual services. It was 0 because what we're looking at in the 2022 adopted is what we presented last year. You may recall that we then went on to hire Lori Miro to help us lead the development of the the behavioral crisis facility. And so her salary went into the contractual services. You just don't see it because it wasn't there in 2022 adopted. We went to the council and we got that approved. But at any rate, contractual services would go up to 100,000. Another time where we would use contractual services is when COVID hit and we had that really difficult problem with the homeless and trying to figure out how to address homeless issues. And we brought on Harry Gilbride. It takes over 2 months to get some of this stuff through the county council, and to have a little bit of money budgeted gives us some flexibility to be innovative, to be creative, and to be responsive at this when the need arises rather than taking 2 to 3 months to get something through council. So we're asking them for that on the front end. And then for cost savings, These, by the way, this is a format that the county council asked us to submit to them, hence the budget is presented this way to you. It's not necessarily the way I would have done it, but it's what council asked for, and so that's what we do. This is again, EMR hopefully make us more productive, and if we should ever get Tyler Energov, which is part of the ERP package that the county's been working on so far unsuccessfully for the last couple of years, if we could ever get that, we'll obviously be much more efficient in our permitting. And then lastly, as I mentioned, we'll continue to go after extramural funding. So let's turn to the budget itself. Again, interrupt me if I'm touching on anything if you have questions on. You will notice there are 1, 2, 3, 4, 5, 6 different line or categories here. Columns. First one, just the account number, 1000 series, 2000 series, 3000 series. The account name really lists individuals who are in them. The 2022 adopted is, again, it's not the actual budget, it's the adopted budget. If a position was never filled, which has happened, it's still there in the adopted budget. It just never got expended. The 2023 proposed is obviously what we're proposing. The plus minus, I think, is self-explanatory. And then the notes is the total increase. And as I had mentioned, it's 5.9% for as a minimum for everyone except for Dr. Fox and myself. For myself, I looked at what the lowest paid person was going to get in terms of their raise, if you will, which is hardly a raise when you're just making $2,000 more and your cost of living is increasing to about $400 a month. But the lowest person here is our billings records registrar is making $2,000, and so we pegged mine there, which comes to 1.4%. Dr. Fox then was 1.4%. Everyone else was 5.9%, except for the individuals that you note here. Now I'll point to those now. So if we go down the line here, you'll notice a 22.3% increase for the nurses or the nursing category. That's not quite as it seems, because you will recall that we increased mid-year after the 2022 was adopted. We increased their salaries to try to get them to be a little bit more competitive with what was going on out in the out beyond our walls. And you will also recall that every single one of our nurses who left was offered a minimum of $10,000 more than what we could have offered them. Some of them offered $20,000 more. And so mid-year, we went ahead and increased their salaries from 49 to mid-50s, 57, I think it was. And now we're just asking for an additional 5.9% to make them, to keep them whole. So it looks like it's a 22.3% increase, and it is if one goes from the year, but it's really just a 5.9% over what they're getting right now. Going on down, you will notice other significant differences. I'll go to the inspectors if I could, the environmental health specialist and the food service specialist. These are the people that I particularly wanted to try to get. These are the inspectors whose salaries just needed to be boosted to make us competitive. And so we're going to propose a 20.2% increase for them. If we go then, everything else is pretty much self-explanatory and not particularly remarkable. I do want to bring your attention to the third page, really the bottom line here, grand total. We'll note that it's an 8.6% increase overall in the overall budget, which, and I didn't plan this, which is the exact number that is now being reported as of May for the cost of living increase, 8.6%. So that's there. And
I have a question.
be happy to.
I just was confused about the line on the second page about the director of nursing eliminated one position, but then the proposed salary went down quite a bit. Can you
It was actually, there were two people budgeted at 60,000 for 120,000 in the 2022.
Oh, okay.
And so we consolidated it into one, but needed to offer a higher salary
I
in
see.
order to be
So going from
competitive.
60 to 82, right?
Yes.
That's an appropriate salary for director of nursing, yeah.
Yeah,
Okay.
and that.
I
that was
understand
it.
now.
Yeah.
Questions for Dr. Bob?
I just reiterate, thank you for getting if one more environmental inspector stays here for a year, gets trained and goes to the next county's over, I'm gonna just scream. So thank you for getting it at least competitive.
I share your sentiments. What John's referring to most recently is unfortunately just lost another environmental inspector who is going to Elkhart, working for the city of Elkhart for $18,000 more than what he's currently receiving.
And why wouldn't he?
Absolutely.
Right.
Right.
Yep.
So, I have a question, and I know I've asked this before, and I want to really compliment you on the extraordinary success you've had in all of this extramural funding. And I think when I asked this question before, I was told all that extra money doesn't come back to the health department. Or what I want to know is, if you're getting all this extramural funding, why can't you direct it towards appropriately
You mean the
establishing
1.6 million,
salaries?
the 1.6 million, for example?
Well, like, not just that, but just the fact that you've got $3 million of extramural funding, and the amount that you're asking to increase salaries doesn't even approach an increase of $3 million.
Well,
Why can't we
No.
just?
You know, the extramural funding that I'm talking about is not reflected in this budget. It's not reflected. So the extramural funding is these other 22 grants, and there are funding, for example, the community health workers that are working in the HEED department, the HEED unit, are funded with the extramural funding. Their pay isn't reflected in here.
It's
at
not
all.
even on here.
That's not
Okay,
in
I
here at
see,
all.
okay.
The bigger question though for me is, and this is part of, quite frankly, the frustration from coming from not having worked in government, where I had, in my particular case, essentially $20 million that I could spend however I wanted to spend it. And now to come here to the working within government, and you can't spend 5 cents without going through a 2-month process. It is a self-fulfilling prophecy for those folks who think that government doesn't, is not efficient and it's not effective. It's like, yeah, you want to work this place like a business, which is what I'm trying to do and which is what I came from. Give me some flexible dollars that I can't spend. And if my group and if my team goes out and earns $1.6 million, why do we have to then going to the Board of Health is one thing, of course, we're working together, blah, 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 blah. But now the Board of Health, you all are being told you can't do anything either. You got to wait 2 months to get all this stuff through the county council. And then the commissioners may veto it anyway, and then it's got to go back and maybe get moved by the county council, or maybe not. And your hand gets slapped. So if we try to make things more efficient, we try to be responsive, we try to, be innovative and creative, but the system is not conducive to that.
You talk about capital spending in 2023 and talking about needing more space and maybe different office space and things. I guess I'm unclear about that. Are you anticipating that some of health department budget, the fund money that we have set aside, 3 million, would be used for that? Are you thinking, is the county going to give? Are you asking for additional funds to deal with capital spending, or how are you addressing this issue? Of kind of capital spending.
Yeah, it's a terrific question. And you asked me how I'm doing it. I'm saying I'm doing it probably poorly and failing, to be perfectly frank. The need for space has been recognized for more than 20 years at the health department, is what I've been told by virtually everyone who's been around that long. And I have gone to the commissioners and I have gone to individual council members, and I have pleaded, begged, questioned, asked for help. How do we address this issue? Most recently to Andy Castiglione, and have said, I'm willing to put our money on the table to help with it. We could, or, their money on the table, a combination of it, whatever. But nobody is willing, I don't have enough money, we don't have enough money to build a new building and put ourselves in a space that's going to make us more effective and efficient. It's again, not a private business. If I was in a private business, I'd go get a loan. I mean, I'd have the business plan and I'd go get a loan and I'd do the investment, make a little risk, and we could do it. We can't do that here. And so this depends on the commissioners and the county council coming up with the money. Well, no one's going to touch this with a 10-foot pole between now and November. And that seems to be a common theme. In addition, nobody knows what's happening with the city. And you're all very well aware, and I, as aware as I am, or if not more, city might move out of here, and it's all caught up in lawsuits from various different,
It is, and I've talked to some of the commissioners and councilmen as well, and they're apprehensive to do anything. I mean, if they take over all the space in this building from the city, they don't want to start moving massive departments out, and they're about to take on tens of thousands of square feet of office space. So the city of South Bend and the South Bend Community School Corporation thing needs to get worked out. In the meantime, isn't Beacon building a new building?
So we thought we were going to get before. We thought we were going to get, and I had been promised this building across the way for the health department.
Okay.
But then the city decided to move out of here, which then
So now everything.
brought in that issue. And it's too bad, because I think we could actually make money and be more solvent in the long term. Now, the one thing, again, my cards are on the table here. When I say that we'll be solvent through 2028, in 2028, and I actually think it'll probably be 2029, but through 2028, at 2028 or 2029, we're going to have a discussion. Who do we riff? Do we increase the tax rate? It's going to have to be the discussion that would have had to happen in 2023.
Okay.
Now, also would say that if we can become more efficient, if we can go after more extramural funding that offsets salary of departmental staff, that extends the window even longer. But, and God only knows, whoever predicted COVID, whoever predicted this sort of inflation,
Yeah.
God only knows what's going to happen over the next 5 or 6 years. And my own personal opinion is we'll take that risk. I mean, we're talking 6 years from now. I would wager that there'll be maybe 2 of us around this table who are still here, and it won't be me, for sure.
So could we move to a motion then to accept the budget as it's presented?
So
Second,
I'll second that.
I know we've had a lot of discussion already, but just for the formality of it, any other discussion? Hearing none, we'll go ahead and vote. All those in favor of accepting this budget as presented, say aye.
Aye.
All those opposed?
Nay.
The ayes have it, so we have passed the health budget as presented. The next item on the agenda is the countywide lead initiative budget. Dr. Bott.
Yeah, thank you. This budget is, as mentioned, reflective of the fact that one, we're becoming more aggressive in terms of that. There are, if you will, two broad initiatives. We reviewed these at the last Board of Health meeting, so I don't want to spend too much time on it. But one relates to the Perinatal Initiative that Mark is spearheading, and the other is this new initiative that to meet the state statutory requirements that we now case manage from lead levels of 5 and up. And we'll be doing our own case monitoring from levels of 3.5 to 4.99. And so this budget is simply reflective of that. And it's essentially the same as what we saw last time with the proviso that it's a 5.9% increase for all of the personnel. I will mention, and this came up at the from the Finance Committee, the recommendation from the Finance Committee. You'll note group health insurance is up to 27.1%, 18,300. We have no control over that. This per a number of individuals who, for that matter, myself included, since I purchased my own health insurance for my wife and our daughter, this is an exorbitant amount to pay for an individual. This actually only covers the individual. If his or her spouse is working and has the opportunity to get health insurance, this health insurance will not cover anyone except the St. Joseph County health employee. It's really an exorbitantly high in my eye, and in my view and my own experience and the experience of the Board of Health members and who are on the Finance Committee. And, I'm not exactly sure how to address it. But a good opportunity for Board of Health members and our attorney to reach out to the powers that be, elected officials, to figure out why we're paying so much for health insurance.
So again, the caveat, Finance Committee met with Dr. Bob and Amy to craft this budget and ask questions and so forth. So, but if others have questions for Dr. Bob or Amy about this budget, please proceed.
I realized I should have said this before the last vote. I just want to explain that I have a lot of questions, and why I'm voting against the budget isn't because I necessarily disagree with any particular thing in the budget. There are a lot of things I agree with, but I just, as not a member of the Budget Committee, I just got the budget yesterday, and I just haven't had time to review it. So, I mean, I don't think anybody wants me to sit here for 2 hours and like ask all the questions I have about the budget. So that's that. I just wanted to make sure that that was on the record. That is my reason for not voting for the budget. I just have not had enough time to give it, and I hadn't enough opportunity in the 30 hours since yesterday morning when I received the copy till this moment now to actually meet enough and talk about it enough with other people here on the board and in the health department to actually figure out what's going on, especially since this is my first time. I just wanted to put that on the record. That being said, there are certain things that, especially with regard to raising salaries to a level that's more competitive so that we can get better people. I don't want to say better people because that would be rude to the people who are here. Oh, very good. But get good people and retain good people. I'm in support of that. So that's just my statement.
I think it's a very fair statement in the sense that we will continue to work hard to try to get this budget out in a draft form. We recognize that, when it's in a draft form, it can't be shared with anybody except members of the board. So if I sent it to you 2 months ago, it could be only us who can discuss it. But we'll work harder at doing that and and Jenny will 20 wet noodle lashes to any finance committee who is unable to attend the 5 different meetings that she has scheduled. And we'll have, and I promise if it's a 6 o'clock meeting, it'll be dinner and drinks
Oh.
next time.
That was John's request.
And not on a Monday, okay. But maybe that, since everyone could make it at 6 o'clock, it makes me wonder, maybe it wouldn't be so bad to have, we could do, correct me if I'm wrong, but we actually, we have a particular grant that we met all the deliverables on, and if it gets passed for an appropriation that Amy is putting to the council this next, actually, I had to put, because she came on vacation, it's going to give us the flexibility to actually have to pay for a dinner with the board.
Wow.
You and I buy alcohol.
If I may, I'm going to ask for a motion to approve the countywide lead initiative budget.
So moved.
Second,
I would have to second that.
and again, for formality's sake, any other discussion?
I had a quick question. Is the insurance rate from a sole source vendor, are we required to go?
I'll tell you all about it later.
Okay, all right. You gave me a face earlier.
Awesome. Hearing no other discussion, then we'll go ahead and vote. All those in favor of approving this budget, say aye. All those opposed?
Nay.
The ayes have it. We've approved the lead initiative budget. And now we'd like to invite Robin Vita to come up and do a presentation on the Hope Unit.
And I'm trying to think, Jenny, if you wouldn't mind advancing my slides, I'm gonna stand here so no one has to turn. I don't know if you read this.
Oh, click on that little
Thanks,
minus
Cassie.
sign. Yeah, the minus sign. Yep. Yep.
Okay, thank you.
Minus throughout.
Great, thank you. I'm Robin Vita, for those of you that I have not met, which I know you and I know each other from somewhere. I am the Director of Health Outreach, Promotion, and Education here at the Department of Health. I have been here for almost 15 years. So yes, I age well. And I started really young. So I'm excited to share some updates. I know I was in front of you guys just 6 months ago, sharing some of this information. So I will be brief on the updated things. So if you would go ahead and advance my slide. Yeah, you should be able just to hit the arrow on the keypad and it'll move you forward. Right, the space bar?
Oh, it's been kind of funky.
Oh,
All right.
okay.
Yeah.
When you said that, it made me chuckle because I had an issue earlier. So our team is small but mighty. We have recently hired a fetal infant mortality program assistant, Lauren Rose. She's a local nurse here at Memorial Hospital, has done lots of work in the maternal infant space, and we're extremely excited to have her to help us be even more efficient with case extraction and case review. And we have several spots within the county budget, and most of our program offset is through the local health maintenance funds. Okay. I'm sorry, that is being so crazy. Next, you'll see our core functions. So these are things that are integral to our HOPE team. They focus on communication, so internal and external. So marketing, flyers, community events, those things go through our team. Thank you. Media as well, so social media. We host Facebook, Twitter, and now a new LinkedIn profile as a way for us to interact in a more professional space with potential employees and other organizations in Indiana, but also across the country. And we manage our website, and I encourage you to always look there. I did look to see in Ellen and to Marcel, our executive sessions of the femur case review team and all of our work group meeting dates, times, and locations are on our website. So if you click on Hope and the overview, you will see all of those things listed there. Outreach, education, so that's pretty, at this moment, self-explanatory. Individuals, organizations, businesses, schools, they will ask us, and at times our health promotion specialists, to provide some sort of community education as it focuses around primary prevention. And our health promotion specialists and our community health workers, as well as some of our mobile outreach team through nursing, work collectively addressing a lot of those outreach efforts and experiences. Creating a culture of public health, so cultivating a lot of individuals who showed support through our vaccine effort that we had when we had our COVID-19 vaccine clinic, utilizing those individuals and helping them stay connected to our mission. And that's been an exciting, I think, addition into our team. Last time I presented, we had debuted our video that Chuck Fry and Jacob Titus have been working on. Since then, we've had 2 additional videos that were produced. They're coming to Bob and I on Friday to be viewed for the first time. So I'm hopeful at a subsequent Board of Health meeting to show you those. They're much shorter videos. One will focus specifically on our food services and that important work, and then another one on Harry Gilbride and some of the work he does Wash Wednesday in congregate living settings. And then our third video will look at our lead efforts, some of our community health worker team, and Dr. Fox is unaware of this, but we'll feature him in a small capacity. Next slide, please. So we have, our Hope team does have a few strategic focuses in addition to our core functions here at the department. The first one is mental health. So really honing in on, I'm going to focus on today, talking more so about where we've made progress. So in these last few months, we've been focusing on our overdose response plan, which started as an effort that at a single point in time, an abnormal number of overdoses were reported through our ER surveillance system. There would be a communication cascade that I would begin. That would elicit that information from specific community partners, and we would make sure they had enough Narcan, since we are a county, we are the county's Narcan distributor. And through those alerts, when we first started this project in 2019, we didn't have any alerts. In the first 6 months of this year, we've had 4 alerts that we have had to utilize that communication cascade for. And really what has grown from that is, I think, more buy-in from individuals in that circle, our law enforcement organizations, our hospitals, other community partners, to really share information that will allow us to issue that alert before waiting for the ER to give us a number. Since we do see things happening on the street, aren't always adding up in the ER. So that's been exciting, and we've begun to adapt a similar process for suicidal ideation and self-harm alerts, the communication plan that is. So how do we, when we are alerted, do we work with partners who actually can do something to ensure we're intentional in those immediate moments after we get that alert? Overdose stats, you can see so far this year to date, or as of May 25th, which was our last report from our coroner, we had already experienced 33 overdose deaths and 21 suicides. And I spend, I would say, probably 75% of my day working in this space, really convening, coordinating, trying to steer towards best practice to be effective here in these both substance use as well as suicide. Next.
Oops, sorry to interrupt. I was going to ask this earlier. What's the Essence surveillance system? Is that what you're just talking about?
Yes, so that's the ER surveillance system. That's a requirement for emergency rooms to log a chief complaint as well as a discharge diagnosis for all of their ER visits. So
Okay, great.
that pulls from St. Joe and Memorial. And then when we do get an alert, we have individuals at the state who will go in and verify that it's truly an alert. We had this incident this week where we received an alert and they weren't all true overdoses. So Shelby Nerdman is our person at the state who helps me with that. But more importantly, I also verify before I send it to community partners. Just so that we know that we really are seeing a true increase rather than it being a 1-year-old who accidentally ingested a Tide Pod, which would show up as an accidental poisoning, okay? And would not fall in our definition of an overdose. Our other focus area, we've discussed a lot about our maternal and infant health team tonight, and just listed again were those recommendations that Dr. Einter shared with you earlier. We have these last few months, one of our biggest successes has been the integration of a community health worker into Women's Care Center, since we have identified that it's insurance and access to that first trimester prenatal care. That is one of our preventable ways to prevent infant death. And we have an amazing individual who makes sure that that's happening. So mom can be connected to care right away, but then also connected with a provider who's accepting the insurance in which she receives. Those are glaring barriers. And that's popping up, the insurance issues popping up, not just here in this space, but also in our suicide and overdose space with access to medication-assisted treatment and those types of things too. So that's something that we're really excited about to see. And our hopes are that we help instill a process where every woman has adequate access and then is receiving quality care early in her pregnancy to catch any potential complications. Next. And then lastly, obesity, and I say this lastly, coming into this 6 months ago, this was really probably one of my personal passions, and it still sits there as one of them. We've been coming out of the pandemic, really addressing some of those immediate needs around overdose, suicide, and infant and maternal health issues. We still are always keeping our pulse on some of the main causes of chronic disease, right? Our goal and hope is primary prevention. So we want to prevent disease, injury, illness before it ever begins. And we've been, and I forgot, Bob mentioned that it says re-imaging, it's reimagining the development of the infrastructure for our coalition. This is a group that I would say every couple of years needs a little bit more momentum, right? We know work here really is going to focus in policy and systems. So getting individuals to support that isn't hard, but the work just in its nature is hard. And we continue to do our best there. And we're excited to see where that goes. Okay. I think that might be it, Jenny. Was there one more?
That's
Great.
what you gave us.
Questions? Any questions? Mhm.
I was just curious, I guess I wanted a little clarification. So the Essence alerts, it says here, suicide, ideation, self-harm. So are there alerts for going into the emergency room, somebody who is either like trying to attempt suicide or hurt themselves in some way? So that is an alert to other, like, what, I guess I'm just asking again, like,
Yeah.
like, what is the purpose of asking for these alerts? Like, are you trying to draw resources to this person, or are you trying to just
potentially
get a sense of what's going on in the community? Are there
both?
like clusters of
Mhm.
suicide attempts?
Yes. And like, for example, we saw back-to-back suicidal ideation self-harm alerts when there was ISTEP or I-learning recently. And so,
So I learned the new I-step
Yes.
test, right?
Yeah.
Okay, thank you.
and we were alarmed because of the age of the individuals presenting. So our suicide ideation alert is specific for children 5 to 17.
Oh,
Now, again, when we get alerts, we go in and we verify because individuals that who have reported child abuse or any sort of assault, they are provided a SANE exam. And that is right now, in essence, that goes underneath suicidal ideation, self-harm. And it's labeled that, so we can pull those out and say, okay, oh, wow, there is this. And really, it's a surveillance system. So our main goal here at the department is to be data-driven. And we are using that to, one, gather partners. So we don't lack passion in our community, but at times we lack coordination and connection. So I believe that's one of my superpowers, is to be able to convene and help support and steer individuals to work collaboratively together. And that's where we saw success with the overdose and the overdose response piece. So we've asked in March, end of March, I asked Shelby, our person at the state, if she could do that for suicide as well. We had been prompted by a news inquiry. I had taken some information to Dr. Einhers, and I was pretty shocked at what we had seen. And we thought, okay, let's really look here at this so we can be more aware and we can make sure our actions will I guess move the needle, so to speak.
okay. And so you have that for attempted suicide, self-harm issues, that you also have an Essence Alert program for overdose.
Correct.
Got it, okay.
Yeah,
That
and you
was the
can
other
run
thing I was-
queries for tons of things. I know Cassie and I've worked on lots of different things, and the individual at the state are extremely supportive. We are the only local health department that does suicide alerts. So that's exciting because we're able to share what we're doing with other departments. And we've been able to think really innovatively on what a response plan looks like for that. And we've actually looked to some other states for ideas and thoughts. So I'm excited to see how we can begin to address that in a larger capacity.
Do you think, and is part of it trying to figure out ways to get people to not get to the point where they are engaging in self-harm?
Ultimately.
So, okay.
Yeah, ultimately. And we had a meeting today with our some of our community partners, Oaklawn, and that was somebody presents at the ER and they're given resources and that's it. It just stops there and there's no real safety plan in place, right? So that's an immediate need that needs to be addressed.
Okay.
And then we can work from tertiary to secondary to primary.
Okay.
That's so moving up the stream.
So not just giving them a piece of paper,
Exactly.
giving them
Right.
kind of a direction.
Something that'll actually be helpful.
Okay.
Yeah.
Good.
Yeah. You're welcome. Other questions?
What's that little thing in the picture there?
It's Dobby.
This was, and I had issues. So we actually, part of our Reducing Obesity Coalition, they do an annual Rock Your Body event, and it highlights resources in our community that can help you lead a healthy lifestyle. It's really a fun event for kids. It happens in conjunction with DTSB and their Kids Night Out. We did not do it, of course, in 2020. The year in 2019, we saw about 15,000 people come through our event that year. It was best week ever. We were the main highlight. There were fireworks, all these things. We did have our first one. We tried to do it last year and it rained. And that's where you can see Frank, one of our HEED team members, and Sarah and Kristen, our two health promotion specialists. They were passing time while waiting for the storms to pass. So that was, who knows where that popped up. And I meant to include pictures of this year. We just had we did our event this past, June 3rd. And we had about 500 folks. So, and that was exciting. So it's just a way to get out in the community and show people being healthy can be fun.
This is
Can I make a comment about the mental health, because it relates to your question and your question and the role of the health department. And I think it's for you, Dr. Kurthert, as well. I just want to make sure that you understand at least our perspective on this. The continuum of care in mental health is growing here within the county, but it still remains relatively impoverished. It's not fractured, but there are a lot of gaps still. And surveillance, we don't have the best surveillance system, but this is the best we have right now, and we're working to improve it. And the real question I think that you're asking and that we're asking ourselves is, okay, we know this is happening. What next? What else has to be there to address and to improve, if you will, mental health within this community, and to prevent the primary prevention, secondary prevention of drug and suicide overdose deaths. And so one of the things that Lori Miro is involved in is she spearheading the development of the behavioral crisis facility, which is designed to be an alternative when an individual needs help, an alternative to taking that individual to the emergency room or where they're really not prepared to manage that person, or to jail. But that then entails coordination with 911 and the mobile team that Oakland is putting together. And it also then requires coordination with police and fire out in the field. So how does 911 and police and fire and the hospital systems and Oakland and Oakland's primary care and this new behavioral health facility that we're all putting together, how does this all fit together? How does it coordinate? How do we truly partner to address these issues of depression, suicide, domestic violence, et cetera, et cetera, et cetera? And so, and as Teresa and I were talking about it just a couple of hours ago, we don't have the personnel as a health department. We never will have the personnel. We're not the effector arm in terms of actually delivering the hands-on care. But we do have collectively fair expertise in this area to help coordinate, convene, and affect these partnerships, and if you will, serve as a bit of a central nervous system for the various things that are happening out there. It's a huge issue. The burden of illness, of mental health, as I've mentioned previously to this group, is as bad as or as burdensome as heart disease and cancer when one collectively looks at the various components of mental health. So, and then lastly, I'd say the work that Cassie and our partnership with Notre Dame and Frank Spacer are doing on bringing up an ACEs team. So our adverse childhood experiences and positive childhood experiences, the work we're doing there, really looking at very long-term primary prevention where the impact is 20, 30, 40, 50 years down the line. But also a very unique part of what our health department is doing.
Another question?
This is just like a last minute question that popped in my head, but I'm curious. I see Food Access Council of St. Joe County. And because I'm reminded of this every time I go to the grocery store. It is expensive. And how are you seeing, what are you seeing personally regarding food insecurity in the county? And are there enough things in place to address it, or is it getting a little?
We know our food pantries are overutilized.
Yeah.
So their demand for food continues to increase. We saw throughout the pandemic, there was of course an influx of support and services. And then they kind of lulled a little bit, and then that's gone back up recently with rising cost of food and that type of thing. Again, I think it goes to connection, and food pantries, even the food bank, they have a lot of criteria one would need to meet to be able to access those resources. And I think we have other organizations trying to feed people like in an immediate sense. I know, for example, like Hope Ministries is going to reopen their kitchen for breakfast and lunch here soon. So I never feel like there's enough resources. So but speaking fairly, and I'm fairly somewhat disconnected. Like we've been working with United Way to kind of overtake. So I act more as an advisor that relates to some policy things. And I think they've just been stuck in day-to-day operations. They haven't been able to really project what's happening.
Yeah, I mean, I know that this is like one of the core functions. There are other of the department, that there are other entities that deal with this. But I guess I was just wondering, especially for people who are kind of on that edge.
I know our social needs assessment show food as one of the, what is it? It's at least one of the top 3, isn't it?
Oh,
It's the top of the 350 individuals that have filled it out. Food is the #1 need that people are asking for. That's where we have a partnership with United Way and their DoorDash program to also address transportation, which is the second one. They will deliver food directly from the food pantries directly to the families. And Jim Baxter has the updated numbers on those, but I can't remember, but they've, it's been high. It's been great. And the other aspect of that is our community health worker in the Walkerton, North Liberty area is working on a partnership with Jim, because right now DoorDash will not go to Walkerton and North Liberty. So we're figuring out where our community health worker will actually meet with United Way to then take and deliver in middle ground to make sure people in North Liberty and Walkerton are receiving the same service.
Because Dr. Einhertz invited me, I think you were there to see the community health workers give their comments, successes and challenges portion of their meeting. And that's one of the things that really stuck with me is, I mean, because that is like the, well, Madison County, but there aren't any like little towns there. But I mean, that's a poor-ish rural area of the county. And yeah, so I was wondering, I could see that being a particular issue there. I mean, so good. Thank you for telling me that, for sharing that.
Awesome. Thank you.
Thank you, Robin.
Thank you very much,
Thank you for
Robin.
everything you do.
Thanks.
Thank you. For board notifications, we have a couple of hirings, Francisco Woodcox and Mary Pickens, and we actually have already welcomed them because they've already started. And then we do have a few resignations, Christina Singleton, Peter Rust, and Sheila Kimbrough. And we wish them well. Public comment. Amy, would you look on the clipboard real quick and just see, are there any names on there? Okay, wonderful. So we can pass on public comment, and then the next time we meet is July 20th, 4:30, right here in this room. So we're adjourned. Thanks, everybody.
Thank you.